can always ask, because we talked about before, hey, is it okay if I go ask the patient? Or is it okay if I go ask how they liked that new medicine, or what they felt after lunch, or if they've had a bowel movement yet? If you're on internal medicine, they ask that all the time. After surgery, have they passed gas? Have they urinated yet? So those are all simple questions that is gathering history. And I'm sure we're going to do that in the other lessons or maybe rules. You as a medical student, your job, your role is to gather history, is to ask the questions, not to give the answers, which is confusing because you spent so much time giving the answers. Maybe, you know what, as I'm saying that, I think that is why it's so confusing about M3 clinicals. For the past 2 years, attending teachers, UWorld questions have constantly been asking you questions. And so you're quickly supposed to have an answer. But the real world doesn't work like that. There's not always one right answer. And so it's hard when a patient asks you a question, you feel, or you may feel that you want to answer the question. You want to feel helpful. You want to feel knowledgeable. Unfortunately, that is seen poorly because we really don't know everything, even though we've been spending the past 2, 3 years thinking like we do. Being a lot of our knowledge, intelligence is seen based on how well you answer the questions, how quickly you can answer the questions, if you answer it correctly. And when a patient asks you a question, not necessarily do you know the right answer, even though it might seem like you do. There's always like little things in real life that maybe make it not 100%. I know that this is actually even a challenge that I deal with right now as a resident, since I've now spent 4 or 5 years working to answer the questions super fast. And step 1, step 2, step 3